Hey, this is Jessica DeMassa with WTF Health. What's future health? I'm talking to the who's who of health tech and healthcare innovation. And today, heart to heart chat with the CEO of Hello Heart, Maayan Cohen. We're going to talk about all things heart health and a brand new campaign that they've just launched to help end gender disparities in heart attack care. So, Maayan, welcome. It's great to have you here.
Thank you, Jess. Super excited to be here.
All right, let's kick this off with just a high level overview of what exactly Hello Heart is. I've heard different things, digital therapeutic, point solution. Where do you guys fit into the mix? And specifically, what conditions are you tackling?
So Hello Heart is a digital solution that helps people manage, understand, and improve their heart health. So we're the only solution focused exclusively on heart health in all of its aspects. We have hypertension, hyperlipidemia, irregular heartbeat detection, and also women heart health that is unique. I don't know if you know that, but women are actually not just small men. We have our own unique bodies, and that includes heart health as well. So that's another angle that we cover as a solution.
I'm dying to get into that because I have like a bone to pick with heart health, writ large for just being so male centric. And I can't wait to talk about this campaign in a little bit. But what I want to talk about first is, a little bit about your business model, specifically, the way that you guys are tackling heart health and how you're connecting it to saving costs for self-insured employers and other employers who are bringing your solution in. So this is a little interesting to me, and I couldn't believe when I looked at the Hello Heart site as I was prepping for this chat, how much of a focus you have on really helping eliminate costs for employers when it comes to their employee population. So say a little bit about, the cost savings of Hello Heart.
Sure. So what our solution basically does is it helps you understand your heart health using an app and a heart monitor that helps you detect everything. They're connected using Bluetooth. It also connects to your clinic and it provides explanations. It helps you track everything. And it also alerts if you potentially have risk indicators. And what happens is that people start to use Hello Heart. They start to understand their health. They start to engage with their heart health in a very positive way. So we have very strong engagement over time. And once you're able to create that engagement loop with users, you can also alert if something is wrong. So what our cost saving studies done, and listen, we're in 2023. Everybody's thinking about cost savings. Everybody knows that their trends are spiking and it's going up next year. And there's actually only so many levers you can pull. Heart health is typically among the 3 top cost factors for employers, typically actually number 1, but definitely in the top 3 for everyone. And until now, we couldn't do anything about it. But now, thanks to Hello Heart, you actually can. And it's one of the strongest levers you can pull in terms of cost savings while helping your members. So our outcomes, we had a study that came out a couple of years ago with Validation Institute that showed Hello Heart saves over $1,800 per participant per year. And a recent study that we just released this week have just shown, it was published by our team together with a client that was willing to share their outcomes, which is very exciting to us, which is Virginia Hospital Center. And they've seen $2,800 of savings per user per year by using Hello Heart after just 1 year. But how does that actually happen?
Yeah, let's go.
So the Validation Institute study showed that it's an external organization that basically validated our methodology, gave us a little bit of a hard time, and made sure that everything is really super accurate. And there was a lot of scrutiny in the process to make sure the methodology is perfect. And once they checked everything, they saw that Hello Heart actually reduced inpatient costs. It reduced outpatient costs. It reduced expensive imaging. But on the flip side, it increased PCP visits. PCP visits basically went up 52%. So the equation of when people start to see their doctor in a much more frequent way and get care in time actually does what we all thought it's going to do. People go to the hospital a lot less. And even the users, it was a cohort match study, even the users that went to the hospital, visited the hospital, and their hospitalization was 3 days shorter than the non-Hello Heart users. So basically preventative medicine, which we all assumed works, actually works. And you can see it using Hello Heart. So we're very proud to be publishing our data, and for our clients to be proud and publish their own data. That team was actually, we presented to Virginia Hospital Center together with Aon, their consultants. And it's very exciting for us to see that even consultants, when they look at the data, and a lot of our clients do it with their consultants, see very strong cost savings. So they feel confident to continue and push Hello Heart forward. New clients that are looking for things that help population while, of course, driving costs down are very excited about Hello Heart.
Well, that is very heartening. Like what I did there? I like hearing that. I like hearing that preventative medicine works, and I like hearing that your solution works too. So say a little bit about the clinical outcomes as well, because those are really impressive. I followed you guys for a while, and you're collecting more and more data, which I love to see a startup do. So dig into some of those clinical outcomes. Like what can an employer expect typically, among their population of employees when it comes to what facets of heart health can improve, and how well can they improve? And we're talking about things like blood pressure and cholesterol, right?
Yes. So basically, we're very proud of our outcomes, and we're very transparent as a company. So we've published multiple peer-reviewed studies. I think the biggest one was published at JAMA Open Network, and was led by Dr. Alexis Beatty. She's a very strong cardiologist from UCSF. She also led the Apple Heart study, by the way. And what she found, she took 28,000 users from Hello Heart and tracked their data over 3 years. And in different time frames, you can see that if you look at hypertension outcomes, for example, users after 1 year, but also after 2 years, and the group at a 3 year, if they started in hypertension stage 2, which is blood pressure of 140/90, 84% of them saw a reduction in blood pressure, which is phenomenal. And the average drop was 21 points systolic. And you see it in the 1 year, 2 year, and 3 year group. So you can see that the results are very impressive, and they're sustained. And basically these outcomes were significantly better than basically anything else out there between disease management program and also other digital therapeutics, of course. So if you look at hypertension reduction, if you look at hyperlipidemia reduction, it's very quantifiable. So our clients feel confident in Hello Heart result because they can see in their dashboard how we actually move the needle on population health in a meaningful way. And that, of course, also translates to cost. So you can see how the cost is reduced over time. And you can actually see your population improving holistically in their heart health.
All right, let's talk about the business for a second here, because I mean, I think it's really, we've delved into the tech and kind of how it works, what the outcomes are from a clinical standpoint and a cost savings standpoint. But how's the business run? I'm curious to hear a little bit about your business model in terms of how you guys get paid. So it's like you're selling into employers. You've got great relationships with some health plans. You're in CVS Health, digital health formulary. I know you're one of the apps that's included in there, which is exciting. I mean, but like, so I saw on your website that you guys are 100% performance guarantee. Does that mean you guys are at risk on outcomes? I mean, tell us how you guys are paying the bills over there at Hello Heart.
Sure. We put our money where our mouth is. Basically, I believe as a CEO in very aligned interests with our clients, which I see as partners. And this year, for example, we had 100% client retention rate, which means our clients are very happy and they stay with us for years. So we built a business model that's very, very aligned with the employer. First, you only pay per participant per month, which means, you're only billed for utilization, people that actually use the program. And in the second year, if they stop using it, you stop paying for them. So that's very clear. We have to make sure that people actually use it for you to get paid. The second thing is performance guarantee. Because we saw such repeatable outcomes and clinical outcomes and in ROI, we decided to put everything on the table. And we have 100% performance guarantee on clinical outcomes and ROI. And our clients feel very comfortable around that, because if you have that combination of clinical outcomes and ROI and you have 100% performance guarantee, it makes the decision to work with us very easy, because, hey, we show you great clinical outcomes, we show you great cost savings, we have skin in the game. And basically, if we don't deliver the outcomes, then we don't get paid eventually. So I think that made employers feel very comfortable working with Hello Heart. And that's actually one of the reasons that Hello Heart was the #1 selling solution on CVS Point Solutions Management Program this year. And we're very proud of that. And we just make sure that we're very aligned in interest and also enrollment rates. Hello Heart is typically the #1 most used program with employers. It's a little bit easier for us because heart health is so big. It's 48% of Americans that have hypertension or hyperlipidemia. So we have a big addressable market in terms of how many users need Hello Heart in your population. Half of your members typically would need Hello Heart. So it's easier for us to target them, but our marketing team is very, very effective. And we have omni-channel marketing that we tailor for each one of our clients without them having to do anything. We do all the heavy lifting in the back. They have just the enrollment kickoff meeting and pretty much that's it. If that's what they want, they can also customize. And basically, we typically get 8 to 10% of the target population enrolled to Hello Heart in the first year. So 20% of the target population, which translates, again, half of your users, to 8 to 10% of your overall population will use Hello Heart in the first year. And it will actually grow over time. So high utilization, very clear clinical outcomes, and cost savings are the main reasons that people buy Hello Heart. And that's very, very tied, as I said, to our business model, which I make sure as a CEO that we have skin in the game to make our partners feel good.
I like that. All right. So I have to ask the hard question then. How do you combat those who might criticize Hello Heart as being too singularly focused on heart health? So, we've been hearing about the point solution fatigue, right, that employers feel. And here you are specifically focused on heart health. You're not one of those snazzy platforms that's looped heart health into diabetes management or mental health or, some other kind of typical comorbid condition. So how do you combat that? What is it about heart health that makes it deserve to be its own independent solution?
First, I think if for any reason an employer is happy with the outcomes and the cost saving, this jack of all trades, all in one, but master of none solution is able to deliver, we're probably not the right. We shouldn't be talking. What we see in market is many solutions check a lot of boxes, and it's great and it's very convenient on paper. And the reality, if you want best in class, if you really care about the key conditions in your population, you need a solution that drives outcomes. Why heart? 48% of Americans, by far the biggest condition, one of your top 3 cost factors, typically number 1, but competes very well with MSK and cancer, sometimes diabetes, sometimes mental health, kind of depends on your employer profile, but it's always in the top 3. And you do need specialization. If you want clinical outcomes that are 2 times higher, if you want ROI that's, published and, you get guarantees on, then you do need best-in-class solutions. And I think it's hard, but if you need to pick, 3 or 5 conditions, heart should definitely be one of them. And I think, none of us would want, a dentist to do a cardiology surgery on them. So it's, I do think heart is one of those things that you really want to make sure you go with best-in-class. And also, like, if you really want to drive the needle on population health, to drive the needle on cost and not just check the box, we're the right address. If you're just looking to check the box, we're probably not the right address. On the flip side, I do think it's a real problem. I think vendors fatigue is hard. It's hard to manage so many vendors, so you can only pick a handful of conditions that you're dedicating best-in-class solutions for. We try to make it as easy as possible. We understand that we're a point solution, so we're plug and play. We'll refer to whichever solutions you already have embedded in your population. It's a digital solution. We don't have human coaches, and we don't have nurses, and we don't have clinical resources. We integrate into your clinical resources. We're integrated to all of the health plans at this point. And in terms of how easy it is to buy, we have a great network of partners. CVS, as you mentioned, is definitely one of them. It's our biggest partner, and you can just check the box on your vendor election form, and that's it. Billing, contracting, enrollment, files and materials, everything flows into CVS. So it's you can say that you don't have. It's very easy. It's the easy button. You don't really have vendors that way. So we try to make it as easy as possible for our buyers.
All right, I love that. And I have to say, one of the things you keep saying best in class, and I think that one of the things that is underscoring that for me right now is this campaign that you guys have started to help end gender disparities with heart attack care. So it's called "If You Feel Something, Say Something." And I mean, this is a remarkable campaign, and it could not be any more important, because women's heart health, I feel like as a disorder, has gone completely under-recognized. And I was stunned to read some of the statistics that are published on the microsite that you've created. There's a toolkit in there. There's a study with the American Heart Association that's been published along with your team. And talking about how women die of heart attacks twice as much as men do. And yet it's like almost like nobody's even talking about this. So tell me a little bit about, the campaign, the impetus for starting it, and what do you hope will happen as a result?
So I think we got to a point as a company that we have the luxury to start looking at equity, at equality. And as a woman leader, as you probably might have noticed, uh, this is a very, very important topic to me. And as you mentioned, like close to my heart, it is very close to my heart. Women die two times more of heart attack versus men. It's insane. If a woman and a man both have a heart attack, the chances of the woman to die are 2 times more versus the men. It's the number one cause of death for women. We overlook it. We don't understand it. We kind of ignore it. And I think there's so many things that happen now around women's heart health in general that I think as a company, we decided to say enough is enough. And in this very, very important topic for women's heart health, we decided to raise awareness to women's heart attack symptoms because the reason we die 2 times more of heart attack is twofold. One, we have unique symptoms and we don't understand them. It can feel like you just climbed a mountain and you're sweating and you're trying to catch your breath and you have extreme fatigue, and it can feel like you just ate something bad and your stomach feels off and you're nauseous or you're vomiting or you have heartburn, and it can feel like you just climbed up the stairs with a box of books and you have neck pain and arm pain and some chest pain and you feel dizzy. This is how a heart attack could look like in a woman. It's not the classical chest pain that you see in
your left arm is gonna, yeah.
Yeah, it could be just stomach ache and extreme fatigue, but it's hard to identify these symptoms. So we launched this campaign to raise awareness of the symptoms I just mentioned. And what we're doing is making sure that at least women understand that they might be experiencing a heart attack. And if they feel something, they need to say something. They need to go and talk to a doctor. Because as women, that's key. We get to the hospital 37 minutes later versus men. And every minute counts in these situations because damage starts to accumulate. So basically, we try to raise awareness for these heart attack symptoms for women. And when they get to the hospital, it's very, very hard for them to advocate for themselves. It's very commonly mistaken for an anxiety attack or a stomach bug. So clinicians also dismiss it, and women get discharged during a heart attack a lot more than men, which is insane to me as well. So we need tools to advocate for ourselves, and we need to have tools, and that's part of the tools that are in the app as well, to help the clinicians understand, hey, these are my outcomes. This is what's happening to me. These are my symptoms. These are typical symptoms for heart attack in women. We need to check.
Yeah.
Let's check. So I think gathering employers is very important. We're very proud of the report we published with the American Heart Association. We looked at basically our clinical team, led by Dr. Ido Paz, our cardiologist, did a study with several doctors from the American Heart Association, and they gather all of this data to just bring it up to awareness that there is a big topic here. We need to address it, and employers can actually do something. All they need to do is start raising awareness. They can, of course, use Hello Heart, which is the best thing, but I'm very biased here because I think it's a phenomenal tool. This is what I do every day when I wake up. But even if they don't, just raising awareness to women heart attack symptoms is phenomenal. And we decided to provide a free employer and health plan awareness kit where you have basically May is Women Health Month. And if you don't have any plans, we got you covered. Have a microsite. You can download posters and digital assets and put it in your social media and in your e-signs, and just make sure that you do something that's so small, but so important, in just raising awareness to the unique symptoms that women have during a heart attack. And hopefully,
I love this initiative.
It will help save lives. So
yes, hopefully. No, I mean, truly, and that American Heart Association study that you co-published, I mean, it really, I read through the whole thing. It's not very long for you guys out there. Take a look at it because the numbers, some of the statistics are just staggering. The wait times, and then also, some of the articulation of the symptoms and just how that ends up happening, and women just get kind of overlooked and then just don't know to even advocate. So thank you for putting that together. I think it's really wonderful. What's next for Hello Heart? I mean, what's on the agenda here? I mean, you continue to drive forward and scale up. I mean, it's remarkable. And like I said, I really appreciate the body of, clinical study that you've done on the outcomes, and also the cost saving studies that you've been doing. So what's ahead? What can we expect from you in the near term future? Can you let us in on anything that might be on the roadmap?
Sure. So we have a few things. Our AI team is working very hard. Last year, we released Dot to Dot that helps people connect the dots around their heart health, how their behavior, like taking your medication or walking more, is impacting your cholesterol levels, your blood pressure, and how you actually can see those trends personalized to you and help you connect the dots. Our AI team is working on new features that will help you identify risk in time, which doesn't exist today, which is very, very exciting because you can only see, tables and thresholds, but you can see a lot of other things in data and you can see trends. So that's one of the big things coming up, using AI to really identify risk in time. On the women heart health, again, we're seeing huge opportunities, and women have so many more aspects. They have menopause, and during menopause, there's a lot of changes to your heart health. So we're going to have a series of features that is going to come up around women's heart health that's coming up as well. And this campaign, I think this was kind of like the opening, the report that we just did with the AHA, and basically the employer toolkit. We're planning to have a big creative campaign around it in the summer and use our power for good. And if we're already out there and we're pushing women's heart health for our existing clients and for the clients that really decided to take it seriously, double down and create equity in their organization for women's heart health, we want to provide more tool around women's heart health, and also, of course, raise awareness even for the ones that are still in a phase where they're starting to create that equality for women and provide free toolkits for them as well.
All right, Maayan. Well, I'm going to do one more. This conversation really got my heart racing. So thank you so much for joining me and telling me all about what's happening at Hello Heart, and specifically this campaign. I really do. Also, as obviously a woman, I completely appreciate this focus on women's health in such a meaningful way. And so thank you again for putting that together and for stopping by and telling us, what we can expect moving forward. It's been a pleasure to speak with you.
Thank you so much for your time, Jess.
All right. Well, that's Maayan Cohen. She is the CEO of Hello Heart. And for more interviews with the who's who of health tech as they are changing the way that we do healthcare, you can head on over to my YouTube channel. It's youtube.com/WTF Health. We'll talk to you guys real soon. Take care, everybody. Bye.